Hello, and welcome to an overview of the CMS Star Rating Scorecard and Decision Support Info app, an executive summary of a Medicare Advantage contract's predicted CMS Star scores. This info app is built on the Omni-HealthData platform and is powered by WebFOCUS Business Intelligence. CMS Star ratings are extremely important for Medicare Advantage, as evidenced by the fact that 4-star plan enrollment is up from 52% to 68% in 2017. 90% of contracts that left the market between 2013 and 2016 were below 4 stars, and with 73% of new enrollees choosing 4-star plans or above, in today's competitive market, you may not even be considered unless you have equal quality or better. For this overview, we are a general manager for the Medicare line of business. Here, we have data for a Medicare Advantage and prescription drug contract whose claims and clinical data are onboarded via Omni-HealthData, our information management platform for healthcare payers. We have selected to show some Part C and Part D measures. However, this dashboard is configurable to show some or all of the measures that a plan reports for their Medicare Advantage contract. The top 2 rows show performance scores for individual clinical quality measures, or CQMs. We have set the goal to 4 stars, and it is our job to create a strategic roadmap to get there for the line of business we manage. Points for each CQM are calculated based on compliance percentage and the weight associated with that measure. Today, we want to focus on colon cancer screening, which has only 1 star, and then get into some what-if analysis to understand overall impact opportunities. For colon cancer screening, we are at 49% compliance, and when we compare that with CMS reported cutoff point of 81% for the previous year, that equates to 1 point. We know that points scored for that measure is also displayed as point score equal rating times weight. Let's take a closer look at the practice and provider level by clicking on the star. This shows the number of gaps open by provider or practice in a descending order. This information helps us, as the general manager for the Medicare service line, identify top providers or provider groups, which either need performance improvement incentives or data sharing agreements as part of their network contracts. To make it easy to communicate up to our executives for further action, we can export this information in Excel with different tabs for practice, provider, and member details, so it can be used to take next steps for review and action. In the bottom left, we can access a metric summary report with all measures, numerator, denominator, compliance percentage, and the goal, as well as the number of gaps to close to get to the target. On the bottom right corner, the Part C and Part D scores are individually summarized, and in the center, we have the overall rating for the contract or line of business. Not only can we see the current contract rating, we can also predict the rating using the what-if analysis feature. It lets us slide performance levers to see how they impact the overall rating. Part of our job is to make sure we use our limited resources for performance improvement efforts wisely. So we pick C15, which is a diabetes outcome measure for controlled blood sugar. It has a higher weight, a ×3 multiplier, and it currently has a low score. Therefore, it could be a greater return for performance improvement efforts for that measure. Sliding the lever for C15 from 49% to 78%, we can see a massive overall improvement from a 2.5 star to a 3-star contract rating. We also see how many gaps we need to close to get to 78%. In this case, almost 13,000. If we click on C15, we can see the gaps reported by provider or practice, which gives us an idea of which providers or groups we need to prioritize in order to achieve the goal. This decision support tool has helped make our management strategy very clear for us. Not only can we see the positive impact of improving measures, but also project the impact if performance on any other measure simultaneously becomes worse. Let's say in our last meeting, we heard that there will be a very high enrollment estimate for our female population, and we're concerned that we may have lower compliance for breast cancer screening, as members may wait for new technology that's being introduced. When we adjust this measure from 69% to 19% compliance, the rating still holds at 3 stars overall because C15 has higher weight and compensates for the projected lower rating of C1. For this Medicare Advantage contract, we are predicting the health plan will have an opportunity to retain about $98 million in annual revenues if it improves from a below-average 2-star to average 3-star rating, thereby retaining existing enrollees and qualifying for future Medicare contracts. These numbers will differ from contract to contract depending on at least 2 factors. 1. Number of contract enrollees, and 2, whether the contract achieves a 4-star rating to qualify for performance bonus or even a higher rating of 4.5 or 5, which allows them to increase their bids to get higher payments from CMS while still receiving a rebate for their enrollees. Depending on the contract size and its corresponding market conditions, such as contracts serving in counties with certain demographic factors, the system can be configured to represent the accurate predictive model for that contract. We can see that CMS is focusing on increased weight for outcomes measures, and now as a general manager for the Medicare line of business, we can confidently focus our performance improvement initiatives, such as medication adherence for diabetic patient cohorts, which will give us better outcomes on C15 and compensate for possible lower scores on C1. This is the enablement of population health, while also maximizing our pay-for-performance reimbursements. To deal with the complexities and variety of data required to understand and improve various aspects of a plan's star rating, we have Omni-HealthData. It is an information management solution that rapidly aggregates data from disparate sources to be used in visualizations and what-if analysis, like this CMS Star Rating Info app, which is designed for C-suite executives, general managers for different lines of business, network performance directors, network relation champions, and medical directors. Any set of health plan-specific measures can be coded into algorithms within Omni-HealthData, and the output can be materialized into the metrics views. Health plans may use similar executive dashboards to track network quality and performance ratings across different lines of business, commercial PPO, Medicaid, etc. Harnessing the power of the Omni-HealthData technology stack will enable a payer of any size to capitalize on these use cases to achieve the quadruple aim, and also implement some of these use cases to increase its profits as it grows the health of its member population. Omni-HealthData is an industrial-sized solution, carefully crafted to meet the needs of modern healthcare. And at Information Builders, we would like for you to become our next success story in our fastest growing industry. All of our customers benefit from over 40 years of industry leadership, award-winning customer service, and the most advanced data and business intelligence platform technology, thanks to the feedback of tens of millions of users from all industries around the world. We look forward to following up with you to help answer any questions about the CMS Star Rating Scorecard and Decision Support Info app built on Omni-HealthData and powered by WebFOCUS Business Intelligence. Information Builders. Better data, better analytics.